Hey guys, this is Dr. Hub. Today we are going to look at the sexual disorders. So to begin with, first we have something known as a desire. So the phase of desire, the characteristic is that it focuses on the patient's drives. So it focuses on the patient's drives, motivation and desires. And the desires. So what is a disorder? So there is the hypoactive sexual disorder. So there is a hypoactive, there is a sexual desire. So in case of the hypoactive sexual desire, the patients have a decreased or absent sexual fantasies. So there is decreased or absent sexual fantasies or desires. Next is the sexual aversions. So sexual aversion is a complete aversion to all sexual contact. So there is complete aversion to all sexual contact. Next is we move on to the treatment of this. So what is the treatment? The treatment is by the addressing the issue. So you address the issue. By this we mean like feelings of guilt. So feelings of guilt and then the poor self-esteem. Next also the homosexual impulses. So all this. Then there is also couples therapy may be indicated if due to marital conflict. So then there is couples therapy. Couples therapy, it may be indicated due to the marital conflict. Next, we move on to a stage of the arousal. So in terms of arousal, what is a characteristic? So it consists of a sense of sexual pleasure. So the sense of the sexual pleasure is seen. The sense of sexual pleasure and with accompanying physiological changes. So there are some physiological changes as well that are seen. So what is this disorder about? So under disorder there is a female sexual arousal disorder. So female sexual arousal disorder. So this is nothing but the persistent failure to achieve or maintain. There's a persistent failure. There's persistent failure to achieve. The persistent failure to achieve or maintain sufficient sexual interest. So sufficient sexual interest or arousal during the sexual act. Or arousal during the sexual act. Next, under this we also have a concept of impotence. So this is the persistent or recurrent inability. So it is a persistent or the recurrent inability or maintaining adequate or to maintain adequate erection, maintain adequate erection. This is until the completion of the sexual act. Until completion of the sexual act. Next, we look at the treatment of the arousal. So the treatment will be first, there is the addressing the issue. So first we address issue such as we address the guilt, the anxiety as well as the fear. Then what we do is we check for the use of medications. So we check for use of medications that cause a vaginal dryness. So medications that cause the vaginal dryness. Like what? Like the anti-menstrual histamines and the anticholinergics. Then also by doing the relaxation techniques. Then to determine if the organic or psychological. So determine if organic or psychological. Next what we do is there is also to considering the plethysmography or the postage stamp test So this was about the stage of arousal. Next we'll move on to the orgasm. So in terms of orgasm, what is a characteristic? So here in orgasm, the characteristic is the physiologic state, the physiological state in which the sexual tension is released. So the sexual tension is released and contractions are produced in various organs, and there are contractions are produced in various organs. Then we move on to the disorder. So what happens in case of the disorder? So there is a female orgasmic disorder, as well as there is a case of delayed ejaculation. So here there is recurrent or persistent inability to achieve orgasm, either through masturbation or through sexual intercourse. Next we'll move on to the premature ejaculation. So in terms of premature ejaculation, it refers to the ejaculation. This is ejaculation before the man wishes to do so. And this is before the penetration or just after the penetration. This is before the penetration or just after the penetration. Next we'll move on to the treatment aspect. So what is the treatment aspect of this? The treatment is that first again we address the issues such as guilt, fear or impregnation. Then use vibrators, education, as well as fantasy. Next is the behavioral techniques. So these behavioral techniques such as the squeeze and the stop and go. Another is the addressing the issues of anxiety. This is about the sexual act. Next is the SSRI. This is to delay the ejaculation. The last is we move on to the pain. So what happens in the pain? The characteristic is that it is the subjective sense of pain. So it is a subjective sense of pain, and this is associated with the sexual act. And it is most likely due to the dynamic factors. So what are the disorders? The disorder is that there is a genetic pelvic pain disorder. There is a genitopelvic pain disorder. So it is nothing but the pain associated with the sexual intercourse. So there is pain with the sexual intercourse in either the male or the female. So it occurs in the male or the female, and it is not diagnosed when the organic cause has been found. It is not diagnosed. It is not diagnosed when the organic cause has been found. It is not diagnosed when the organic cause has been found. When organic cause is found, or if due to the vaginal lubrication, or due to the vaginal lubrication. Next, we look at the penetration disorder. Next, we look at the penetration disorder. In terms of penetration disorder, there is a involuntary constriction. There is involuntary constriction, and this is of the outer 1/3 of the vagina. Outer 1/3 of the vagina that interferes with the sexual act. It interferes with the sexual act. Next, we move on to the treatment of the pain. The treatment is by help with issues of anxiety. So we help with the anxiety as well as the tension about the sexual act. Tension about the sexual act. Next is we adopt behavioral therapies such as use of dilators and relaxation. Use of dilators and the relaxation. So then is addressing issues. So then you address issues such as the impregnation, then also the strict upbringing and religion, etc. So this was about the sexual disorders, and we have discussed some phases such as desire, arousal, orgasm as well as pain. To learn and grow daily, please do subscribe.